New at 10 tonight, Cass County reported 160 new COVID cases today, the highest daily number ever reported in the county.
Cass continues to lead the state in positive cases. Valley News Team's Katie Opperly explains how the current increase could be just the beginning of our concerns.
It's worrying that it's still going up.
Joel Rios of Fargo is masking up, washing his hands, and following all the precautions. But the spike in COVID cases close to home has him concerned.
The cases are still rising when really we should be trying to help those who are A, infected and B, affected.
Area doctors say his concern is valid. With our temperatures dropping this week and more people being forced indoors, they say the risk will only continue to rise.
A lot of it has to do with just people being closer together in the winter because they're inside. As humidity changes and humidity goes down, so heaters are running during the winter, that viruses and respiratory particles do transmit better in dry air.
This week's COVID numbers in Cass County have some blaming the long-feared fall spike, but Dr. Vetter says it's too soon to tell. In fact, researchers say the second wave of infections is yet to come, more likely happening when fall turns into winter. The combination of easier spread in cold air and closer contact could spell trouble unless we do something about it.
If people modify some of their activities as far as maybe better masking, better social isolation, and so on, that could make an impact.
Wear a mask, 100% of the time when I'm out. I never leave home without it.
For now, Dr. Vetter says the best way to combat the virus is hunkering down and staying within your immediate circle. In Fargo, Katie Opperly, Valley News Live.
This news of a second wave continuing to be a threat comes as the world races to find a vaccine. A Gallup poll finds more troubling trends, showing only 50% of Americans are willing to get the vaccine when it's ready. That's a dramatic fall from the nearly 70% that said they would be vaccinated back in July. This attitude is reflected right here in our community.
I would not get one just because of the fact that everything's so fast, there's not enough research done.
To get a COVID vaccine is to help the community and the people around me and my kids, my family.
Health leaders stress that since there will be no vaccine for this season, following the health practices recommended by the CDC is your only line of defense.